Good morning, I am Princess Anbuhokan from BSN2B, and in this video, I will be showing to you how to demonstrate the Leopold's maneuver. So Leopold's maneuver are used to palpate the gravid uterus systematically. This method of abdominal palpation is of low cost. It's easy to perform and non-invasive. It is used to determine the position, the presentation, and engagement of the fetus in the uterus. Before we start our procedure, we have to make sure that all of the materials that we're going to use will be gathered already. So we have two materials that we're going to be needed, which is the stethoscope and the pillow. Good morning, ma'am. I am Princess Anbuhokan, your student nurse for today, and I am from Eastern Samar State University, a BSN Level 2 student under the College of Nursing and Allied Sciences. And I am here to do some assessment on the Leopold's maneuver. And rest assured that all of the findings and the data that I will be gathered through this assessment will remain confidential. Ma'am, may I know your name
I'm President Bohokan,
and your birthday?
July 28, 1993.
What will I address you?
Just call me ma'am.
Okay, thank you. Ma'am, allow me to explain to you the procedure that we will be doing during the assessment. So this procedure is what we call Leopold's maneuver. It has 4 grips, and this is very necessary for every prenatal assessment for us healthcare workers to know the fetal presentation and fetal lie of the baby inside your womb. Is that okay with you, ma'am?
Yes.
So before we start our procedure, you can first urinate for you to avoid any discomfort during the assessment. After that, we have to place the patient in a supine position with slightly knee flex, and we have to put a pillow at the back of the patient to avoid any supine hypotension syndrome. To start the procedure, we have to expose the belly of the patient. For the first maneuver, we have the fundal grip. So in this maneuver, we have to determine the fetal presentation and fetal lie of the baby inside the womb, which means that we have to determine if it is cephalic or breech. You can say that it is breech if it is round, hard, and movable. However, if it is round, soft, and immobile, it means that it is cephalic. So, I will face the client, form a triangle using both of my hands and put it on the fundus, and I will palpate it right here. So, observe the findings that I have mentioned earlier if it is cephalic or the baby is in a breech presentation. Now, we will now proceed to the second maneuver, which is the umbilical grip. So in here, we will be palpating the side of the uterus. So in here, we have to determine or to find where the fetal's back, where the fetal's back is. And this is necessary for us healthcare workers to know where we auscultate the fetal's heart rate or fetal's heartbeat. So we have to use this stethoscope later on the fetal's back to determine the fetal's heart rate, which is 120 to 160 beats per minute. So in here, observe that my left hand will be stationary for a while my right hand will be moving. So you have to palpate it from top to bottom and vice versa. You can say that it is the fetal's back if it is flat, has a resistant surface, and it is hard. However, if you notice any angular nodulations, it means that it is the lower extremities of the fetus, which is the elbows and knees. And now let's go to the third maneuver, which is the pollex grip. In here, I will be forming an L shape using my index finger and my thumb. So I will place it on the symphysis pubis of the patient, and then, so if it moves, when you moves it from side to side or upward, it means that it is not engaged. However, if it will not move from side to, if it will not move when you move it from side to side or upward, it means that it is engaged. And now we'll go to the fourth maneuver, the last maneuver, which is the pelvic grip. So you've noticed earlier that the first, second, and third maneuver, I was facing the client or the patient, and now for the last maneuver, I will be facing the client's foot. We're gonna be palpating it right here, and this is somehow to confirm the second maneuver, which is the umbilical grip. So from this one, we will palpate it downward motion. We have to determine the degree of flexion of the fetal's head.